Now, a few technical questions. First, do 3D printed tablets look and feel like conventional compressed tablets?
So they look different. That's also because of the way that they are being produced in a layer by layer fashion. So you can really see the layers in the tablet. Furthermore, we use a mixture that has a wax-like feel. It seems to be a wax, a bit like candle wax, so it can be quite weird for patients to see the tablet. Though I also have to say that the healthy volunteers that took the 3D printed tablets, I asked them what they thought about the feel, the mouth feel as well, how they experienced swallowing the tablets, and they really looked at me like I was crazy because it was just swallowing a tablet, so they didn't really see the difference with the normal tablet. So I think it depends on the patient that has to take the tablet. They do look different, but it's not. That does not necessarily mean that the patient experiences it differently from a normal tablet. No.
Nice to know. Next question. What is the ink? I mean, the solution or suspension that you use to print the tablets. And what makes it change into a solid tablet? Is it heated or does it harden on exposure to air? How does it work?
Yeah, so we specifically use lipid semi-solid extrusion, which means that our main substance in the mixture is kind of a lipid substance. It's polyethylene glycol monostearate. It melts at about 45, 50 degrees Celsius. Then it's completely melted. However, if you stay below that temperature, it softens, but it doesn't quite melt. And that is the temperature at which we operate. So we keep it just below the melting point so that it does become pliable and it can be molded in the layers for the 3D printed tablet. But it's still so, not fast. Yeah, fast, I think, a bit. For the, in this case, sildenafil not to settle in the mixture as well, because that's the other side of it. If it's completely melted, the drug can settle in your mixture, and then you don't have a homogeneous mixture, which can result in dosing errors. So that's, but in this way, we don't have to worry as much about that. With this, because it's a lipid, and we can keep it until just up until the right temperature, we also don't have to use water or any other solution to make it moldable, which you see with a lot of other semi-solid extrusions. So we don't need a drying step, and we don't also have the chemical stability issues that you would expect when, for instance, water is used.
It occurs to me, listening to you, is it a bit like making suppositories in the old days?
Yes, exactly, it is. In the olden days, when you had to mix your own suppositories and you would use a mortar and pestle, you would be frantically mixing and pouring the mixture in the molds, trying to keep the API from settling, trying to keep the drug from settling, which is also exactly what we're doing here. But instead of completely melting the substance, we keep it at a temperature that it's not pourable, but it is moldable.
Now, please, can you tell me about your project? What did it involve, and why was sildenafil chosen as the active pharmaceutical ingredient, the API?
So for this project specifically, we wanted to see whether we could produce or develop and produce a 3D printable formulation for the pediatric patients that would adhere to all the guidelines that apply to it. So that would be, in our case, a European Pharmacopoeia for the quality control, but also the EMA guidelines for bioequivalence for the clinical equality of the drug. And we chose sildenafil as a proof of concept drug because from our experience, sildenafil is one of those drugs that the pediatric patients cannot be treated with well at the moment. Sildenafil is a drug that is used for arterial pulmonary hypertension, so a high blood pressure in the lungs. And sildenafil is perfect to lower that hypertension in the pediatric population, so in smaller children. But the tablets that are on the market have the incorrect dose, so they're too high of a dose for the pediatric patients. And while there's also an oral suspension on the market, even that suspension has such a high concentration that the small children still cannot be accurately treated with that drug. So that is why we felt that there is a need for a formulation containing sildenafil to be able to treat that pediatric population.